I am back with Natasha Wilch here on Hope Survives podcast. You might have heard her in a previous episode, and I'm so excited to have her back. Welcome back, Natasha.
Thank you for having me. I'm always happy to be here and chat with you.
Oh, I love chatting with you as well. So today we are going to be talking about re-injuries with brain injury. And I wanted to have you on here because I really would love to get the medical professional perspective on this.
Mm-hmm.
I've had over 10 re-injuries. I kind of lost count because for so many years, I only found out that I had dysautonomia in the last 2 years. So for like over 10 years, I didn't know, and I was falling all the time and running into things, and my spatial awareness wasn't there, and I'd hit my head on stuff. And it's not like I was being careless. I was constantly being careful, but it felt like any little bump on my head would bring full-blown concussion symptoms.
Mm-hmm.
Like I hit my head getting into the car, just on the door frame. And it didn't seem like a big deal at the time. It didn't seem like a big bump. But then the next 6 months, I was out with concussion symptoms. So why does that happen?
Yeah, I think it's always important just to distinguish too between whether you've actually reconcussed yourself, which can absolutely happen, or is it the fact that your nervous system is so sensitized to that bump on the head that it throws you into a flare without there actually being a new concussion. And so there's both scenarios that can happen. And so with the the reconcussed yourself, or even take that back in the sense of even when you're talking about I'm super careful but I was falling or I was bumping into things. And so I think the first thing as a health provider, and if you're not, I think this will start to kind of point out too, because when we talk about things, we always mention not everyone knows to get treatment.
Yeah, that's
right?
true.
They think that this is just the way it has to be. They've seen a general practitioner or they've talked to someone who just said, this is your new normal. And I love just on your podcast and everything too, that is not the case. So if you are somebody who, like you experienced, were falling all the time or we're always bumping into things, there's a reason that is happening. Whether it's because you have dysautonomia. So for those that don't know, sorry, dysautonomia is that imbalance between your parasympathetic, which is your rest and digest, and your sympathetic nervous system, which is your fight or flight. And what can happen sometimes is also something called POTS, which is postural orthostatic tachycardic syndrome. Not all dysautonomia is POTS. So I just want to make that clarification. But what that can mean for some people is, and I had clients that this would happen to all the time, is they would go from laying down to standing up and they would faint. They would black out and they would hit their head over and over and over again. And so for that person, every time they had this postural change, they were at risk of putting themselves in further injury. That person kept reconcussing themselves because she would fall with significant force because she had this underlying, like you did, dysautonomia that needed to be treated. So for people who are continuously bumping into things, falling over, there's a cause, there's a reason. And so that would be having an assessment with either a well-trained physical therapist or someone who practices functional neurology or anyone. There's some great athletic therapists out there as well, to be honest, who can do that system. I call it a system assessment. So they look at your visual system, they look at your vestibular system, they look at your autonomic nervous system to figure out if there's an area that is dysfunctional that is leading to this behavior that you're trying so hard not to do, but is out of your control.
Yeah, that's so good. And I like how you're pointing out there's a reason that this happens, because I knew there was a reason. I'm a brain injury survivor, right? That's what I thought was the reason. I had a brain injury. So this is what happens. You're off balance, I didn't realize, well, your brain injury can actually cause specific things that can be specifically treated. And I was seeing doctors, but they just were not knowledgeable about dysautonomia. They were great doctors, but they just didn't know. And so it wasn't until Dr. Jeremy Schmo at Functional Neurology Center, when I met him at a conference that we were both speaking at. He could
Yeah.
tell by my gait in the hotel lobby
Right.
at the place we were speaking at. He could tell by the way that I was walking that I had dysautonomia.
Mhm.
And I didn't even have to tell him. And so I was just like, oh my gosh, this explains why. Because people would
Mhm.
always be like, well, just be more careful. Stop hitting your head so much.
You're like, "I'm trying."
Yeah.
Yeah, and so I think it's for, like, kinda, I guess, like, the summary of that too is, if this is like, if you're someone that keeps bumping your head, if you're someone that keeps falling into things, if you're someone that keeps blacking out, that's not normal.
Yeah.
You don't have to live with that. So it's finding someone. If you're not already working with someone, it's getting that assessment to see if there's something that can be done to treatment-wise to help you
Yeah.
to
That's good.
mitigate that. Yeah.
So, but it's not always going to be dysautonomia. And I just want to say that that was the case for me
No.
personally. So
So
that's my experience. But what are some other reasons that brain injury survivors might be falling or hitting their head more often?
yeah, so it can be a couple. So the vestibular system is another biggie. So I mean, let's look at in terms of system wise, right? So your vestibular system plays a big role in spatial awareness, and in your balance. So if you have a dysfunction of your vestibular system, and this doesn't mean that you always have to be dizzy, right? So people think that if there's no dizziness, the vestibular system isn't involved, and that isn't true.
Yeah.
Okay, so
So
you don't need to have vertigo. You don't need to have dizziness to
would you
have a
describe dizziness as like spinning?
so that's a good question, actually, because dizziness can get thought of in many different ways, and it's a term that gets used interchangeably. So let's talk about it more as, there's a vertigo, which is the world is spinning around you, or you're spinning in your world, but there's actual perceived movement.
Okay.
And if the world is spinning around you, vertigo can be from a peripheral ear issue like crystals or BPV. It can be from an injury to the peripheral nerve, that piece of things. Then there's this feeling of just being unbalanced. That's how people tend to describe it. That will typically be what they talk about with dizziness, is unbalanced, almost dissociated sort of state. That can also be vestibular.
Okay. Yeah, I
And then,
had that. So it's
yeah.
like I would be standing there and it was like I had to hold on to something because I would just feel like I was swaying all the
Mhm.
time.
Yeah. So there's that. And then there's also the feeling of like, you feel like you're going to black out. So people will use dizziness, I find, to describe those three things. So when we actually encompass one of our first introduction videos in dizziness is, don't use dizziness to describe what you're feeling. Try to put more adjectives to it. Try to describe it more. Is it the world spinning around you? Is it you spinning around the world? Is it you feel like you're swaying back and forth? Is it that you feel like you're going to pass out? Because all of those things, how you describe that as a practitioner, leads me to different things that could actually be happening that are very different from each other in their mechanism. So the
That
vestibular,
totally
so
makes
vestibular
sense.
dysfunction is one reason why, because that's going to affect spatial awareness and that sort of stuff too, and your balance. And then the other one is, the other most common one is visuals, is your visual system. So we have our kind of focal vision, which is that like detail oriented, like right in front of you vision. And then we have our peripheral vision. And so what can happen too is that after a brain injury, it's not the scientific term, but I'll say that your peripheral field kind of collapses a little bit. So you don't have as much awareness. So if you're walking and you are legitimately like peripherally unaware, it's going to lead you into bumping into things on that side, right? Or we know that your ability to switch between central and peripheral is slower. So you might see it, but you just aren't fast enough to react to it. So this is the example that I talk about, like kids throwing toys, and as a mom, you get bonked on the head with the toy. Like, you kind of saw it coming late, but you couldn't react fast enough to stop it. Um,
Yeah.
right? So there's these reasons why there can be these repetitive bumps and or reconcussions happening, because of the underlying issue that you should ideally and hopefully be working with a team on to rehab.
Yeah, that totally makes sense. So, outside of how or why people
Mhm.
tend to hit their head more, what happens in the brain? Why is your brain more sensitive to getting reconcussed? Like, And I've heard that concussions or multiple brain injuries build on one another. Is that true?
So sometimes some people talk to us say that yes, there's a cumulative effect. I think that we need to also be aware of, is it a new concussion or is it a flare, right? So for a new concussion to happen, we know we need to have that mechanism that brings a concussion. So you need to have that acceleration, deceleration that happens. What I say to everybody is that if you feel like you've been in an incident where you could have reconcussed yourself, what's our acute concussion protocol? You rest cognitively and physically for 24 to 72 hours. And then we kind of reevaluate where you are and we slowly reintegrate things. That, in my opinion, doesn't change whether you're acute on PCS, right? And I think it's important for people to realize, and then I always say, connect with your healthcare provider so you can do a reassessment so that you can see if objectively, are there new objective findings that are showing up because of this recent hit. Because what will happen sometimes, and I've seen it, is there's symptoms galore, but there's no objective change.
That's a really interesting point.
So that's where we talk about more like your nervous system is sensitized. And we can get into that a little bit if you want to.
Yeah.
So that case where it's not that you haven't actually reconcussed yourself per se, but your symptoms are going crazy. When we think of it, it's kind of the equivalent to chronic pain in this mechanism, right? So, or you'll hear people talk about, well, my doctor said I have a centralized nervous system, or my doctor says I have a heightened nervous system. And they're like, I have no idea what that actually means. So what that means, if we've done this assessment, we know it's not a new concussion, then we start to be like, okay, well, we can't ignore the symptoms. This doesn't mean you can go back into doing what you were doing. You still have to respect it. You still have to treat it appropriately.
How do you tell the difference though?
So for me, I do an assessment. So if there's brand new symptoms that were never present before, I feel like sometimes that's an indicator that something else could have happened. So example, if someone didn't have fainting issues before or autonomic issues before, and all of a sudden they're showing up, that's likely of something else. But then putting someone through, so for me, if it's my clients, because I treat a lot of PCS in the clinic, so I see this a lot, we'll do a reassessment. And we'll see, like, objectively, are there differences? And if there's not objective differences in things like their pupillometry or things like their goggles or some of our testing, then we know we're looking more at a flare than a reconcussion.
Okay. So I have a question. Yeah. So if you mean differences, do you mean differences from like recently before you fell, or do you mean differences from ever? Because my first TBI. Okay, recently. Okay, that makes sense. Because I was like, my first TBI was 2007, and in 2012, I tumbled down a staircase, and I hit the side of my face on like a baseboard, and my glasses snapped. And if I wasn't wearing my glasses, it would have gone straight into my eye. So it was like, yeah, like my glasses snapped. I'm wearing contacts now, but they like snapped. I got hit right here, and it was like a huge head impact. And after that, it didn't seem like there were new symptoms, but it was like I went back 3 or 4 years. Like it was like I went back to like really brain fog, struggling with walking, not being able to think, not being able to have memory loss. And I was like, I regressed like completely. And I don't know if I would have said I had new symptoms ever, but I had gone like maybe 6 months or a year without those things happening.
Yeah. So you don't always have to have new symptoms.
Okay.
But in a sense, it was the symptoms weren't new to you, but you hadn't experienced those symptoms for a long time.
So a flare-up would be
they were new from that new normal.
Okay, that makes sense. Yeah. So a flare-up would be like if I was having a lot of headaches and feeling off, and I bumped my head, not like super hard, but I bumped it, and then I had the same symptoms that I was having the week before, but just more intense.
Yeah.
Okay, so that makes so much sense.
Sorry, bad explanation on my part.
No. I mean, we're learning here, right? That's what we're here for.
So it's comparative to like your current normal, not
Okay.
comparative to when you initially had your injury, because you made tons of progress. You had been
Yeah.
healing and recovering.
And
So
especially if you've had a TBI like over 10 years ago or something, like if you reconcuss, you know, you could go back to
yeah,
you could feel like you went back, but in reality it's a new concussion.
yes, yeah, yeah. And I think too, it's important to know too that a new acute concussion. So I always say acute on chronic. So a new acute concussion doesn't. Here's what I see that happens a lot. People get a new concussion and it starts down this pathway of, oh my God, this is going to take me forever. This is going to be terrible. I'm never going to come out of this.
You get
And
this
I think,
sinking feeling of dread because
yeah,
you know how bad it was the first time and you
yeah.
are
And you don't
so
want to go
like,
back there.
I do not want to go back to this.
And I
Yeah.
think it's important to realize that it doesn't mean you're going to go back there. It doesn't mean it's going to take as long to come out of this moment. It doesn't mean you're going to have to go through everything you went through before. But you almost have to catch yourself before you start taking your mind down that pathway, as hard as that can be, and flip that mindset switch to be like, okay, almost use that as like, I've been here, I have the strength and I have the resilience to come through this again. I know I will. I also have more information now than I had that first time, and I have a team at
That's
my
key.
disposal. So I'm going to come through this and it's going to be smoother and faster than it was the first time. And I know Allie can speak to this because you're going to have her on as a guest too, and her journey through this. So I think that's an important piece to recognize, that just because it sucks, professional language, it totally sucks. But it doesn't mean it's going to take you back to the beginning. And it doesn't mean it's going to take you forever to come out of it, because you are so much more knowledgeable and you have so much more resilience than you did just in the journey you've been on.
That's so good. That's so encouraging too, because my most recent reconcussion was a year ago, December 2019. And after that one, it's interesting you say about the new symptoms because I actually had a new symptom that I had never had before since my first TBI. And it didn't show up right away, but it was speech. Like I struggled with my speech earlier on with my TBI, but I'd never had it to this extent where like the whole of this past year, it wasn't until the last like couple months that this went away, but every time I'd get fatigued, it was like my tongue couldn't form the words. And it was like my speech would slur and slow so much so that like I I could feel when it was coming, and then it was like my tongue was just like sitting in my mouth. And I'm a professional singer. Like I try to be good at diction and speaking, and I've worked on my ability to speak because after my first TBI, it was not great. I've worked on my diction. I've worked on my pronunciation. And so I knew there was something neurological going on because that didn't used to happen when I would get tired. And it was like my speech would get so slow and so slurred. And it was like I just couldn't control it at all. And that was new.
Yeah. Well, and I know you'd asked a little earlier too about like the cumulative effects,
Hmm.
right? So when we look at, and this is why I even talk about like baseline testing with like kids in sport, to be honest, the injury, we can never predict how an injury is going to fully affect someone, but your pre-existing state is going to have an impact on the extent of the injury. So if someone has, this super amazing functioning nervous system and they get a concussion, ideally they were in a really healthy, great state beforehand that they ideally bounce back a little quicker. But when you're already kind of in that rehab process and you already have areas of dysfunction, right? Like, so we know concussion is a functional injury. It affects the neurological connectivity between the different parts of our brain and therefore our like how we function in the world. Depending on that particular concussion, if it's impacting, because again, we don't know why it impacts certain areas in someone versus another, right? But say that for whatever reason that impact then affects an area that's already struggling, that would in essence feel like you compounded the effect, because now is that's where that regression comes in. It's like I was already struggling and now I affected the area again, and now it's I have to keep going back, right? Or in this last case for you, it affected somewhere different. So it's like maybe you didn't notice as many changes in, potentially, I don't know, tell me this too, but like some areas may not have been as affected, but you had a new symptom. It affected a different portion of your brain and you would have had no idea. Like you could have never predicted that.
Yeah. Yeah. And I found that after this last re-injury, I found that my headaches returned a lot more, but I'd seen Dr. Schmo. I'd been to an intensive with him about 6 months before that. And I found that a lot of what he did stuck. So the
Mm.
dysautonomia stuff that he had worked with me on was still there. And it didn't completely go away. And I found some vestibular issues came back, like my sway, I got dizzy and stuff more, but my walking was still so much better. And so it's interesting how, like you said, it can affect different ways. But I love how you said, don't give up and don't feel like it's going to be exactly how it was before, because you know more now. You already have a team hopefully established, or if you're watching this or listening to this, you're looking and you're finding brain injury resources and you're taking your power back, like this time you can get through it in a different way.
Yes, absolutely.
Is there
Yeah.
anything else you want to add about this?
Oh, I could talk about this forever. Do you want me to get into the descent the nervous system bit a little bit?
Yeah, I'd love to hear about that.
So this is where sometimes we're not every little hit is a new concussion. And so this would be an example of, say, you were getting dinner ready and you opened the cupboard and you just like nicked your head. And I say this is examples. This is an example that I've gotten in the clinic. And all of a sudden, symptoms are off the chart, right? That is not a new concussion. With the force that happened, like it was a nick, right? That there's no way. But your nervous system is what we call sensitized, or I say it's primed to notice these things. And so in your nervous, if your nervous system had a brain, if your nervous system had a personality, its job is to protect you, right? Like that's what it's trying to do. And you therefore have a concussion. It's trying to protect your head. And so what happens when a nervous system is sensitized, it basically means that it is more primed to respond to situations that are reflective of what maybe caused the original injury, let's say. So physiologically, what actually happens is your nerves sit, a nerve has what's called a threshold that it needs to reach of stimulation to fire up to your brain. And so normally, say a nerve sits here. When you're sensitized, that threshold is higher, so it needs less stimulation to fire.
Okay.
Okay. So then it travels through, and then there's nerves and neurons in your spinal cord that are meant to help inhibit some of that information. Those don't do their job as great. And then the other piece that's supposed to happen is your brain is supposed to send inhibitory signals. So signals back down that kind of dampen out some of those signals as well. It decreases that inhibitory. So basically what it's saying is like, send me all this information that tells me that I've hit my head. And now I'm going to flare up all these symptoms so that you don't do that again. So it's sitting in a higher state where it can be stimulated way faster, and it doesn't dampen out some of that information like it normally would. It, in essence, absorbs it all.
Okay.
And then produces these symptoms in a protective response. Unfortunately, it's a little overprotective. It's that overprotective parent, right? So it's like, if we don't want you to do anything, we're going to give you, we're going to flare up your symptoms so bad that you don't do anything. And so that's what's happening in a sensitized nervous system. And so that's that person that's like, I keep reconcussing myself, but it's with doing nothing, right? So this is not, if you can absolutely reconcuss yourself. We talked about that earlier.
Yeah.
But this is the like, I keep reconcussing myself, but I've literally done nothing. I like or I grazed my head, or I went over a speed bump, or I like did these things that when even you logically thinking about it would be like, how did that cause another concussion?
Yeah.
I don't understand. Versus when you fell down the stairs, that's obvious.
Yeah.
And
Or I
so
think getting into the car too, because that was gravity. Like I was going to sit down and I really slammed
like,
it.
really
Like,
slap your head into it.
yeah.
Yeah.
Yeah. So, like,
So,
but there's been other times that I do think that there's been like those flare up situations.
hmm.
And I remember I was talking to my neuropsychologist about this and I asked him, I was like, well, I don't know if it was a concussion or not. And this is what he said to me. Well, you're going to treat it the same way either way. So let's just treat it the way that you would if you had another concussion. Whether or not it is, that doesn't necessarily matter as to what you're going to do. So let's talk about what we're going to practically do. And I thought that was pretty good advice at the time.
Yeah, I mean, where it changes a little bit is the rehab after that flare starts
Yeah,
to settle,
that makes
right?
sense.
Because the initial management, exactly. You, if whether it's a flare or whether it's a new concussion, we're going to tell you the exact same thing. When you start to come out of that flare, though, that's when from a rehab sense, we're going to start working on ways to desensitize that nervous system
Interesting.
and so that it doesn't flare. And that's where we can pull in things like imagery and graded exposure and these other tools that aren't typically part of concussion rehab. But
I
if
would have
your
needed
nervous
that. I didn't even know that was a thing, Natasha. You're teaching me so much. How do you desensitize your nervous system?
we just released a mini course for it in Compass,
That's
actually.
so cool.
So yeah, but I mean, this is where we pull in, like, this is where we talk about graded exposure. This is where we talk about I always talk about like our 2 point rule of how much you're allowed to flare your symptoms. This is where we talk about using imagery for people. A lot of people need to start at the imagery stage because we know that imagery can activate the same neural pathways in the brain as actually doing the task. And we start to expose your system to this scenario that causes it to flare. And so the one test I have people do, and if you're do this for yourself if you want to, but if you're listening, so think of a scenario that you're almost that you know like that you've reconcussed yourself in at some point in time or that you think you've reconcussed yourself in. And what I have people do is I have them close their eyes and I have them imagine going through that task or doing that thing. And then I'll ask how many people's headaches got worse? How many of your symptom flares? Hands up. Some of them nothing, which is great. Some people hands always end up going up, and that is in essence like that shouldn't happen. You know you're in a safe place. You know you're not actually going over that speed bump, or you know you haven't actually like opened that cupboard, but your nervous system is responding like it did. And so we use in that case, we talk about different layers and levels of imagery that bring in different levels of activation, but we actually start to rehab desensitizing the nervous system.
That's so cool.
So,
It makes sense.
I find like the profession that does a really great job of it are those, well, there's probably many professions, but physical therapists or occupational therapists that deal a lot with chronic pain.
Okay.
Or neurological like PTs and stuff like that.
That's great. That's so good. That's so good to know. Thank you so much for sharing all of this information. I've learned stuff. I know that our listeners have learned stuff. So this is good. So if you want to get in touch with Natasha, she is one of the founders of Concussion Compass. Your website, do you want to share how people can get in touch with you? Instagram, stuff like that?
Instagram. So it's just at natasha.wilch.
Okay, perfect. Thank you so much for coming back on the podcast, and we'll look forward to having you on again for sure.
Always a pleasure.
All right.
Okay.